Welcome back to the Morning Blend. Okay, so I like to think I'm unique. Turns out I'm not as special as I think I am. Okay, I'm just like 16 million other Americans because I have rosacea and I don't like it. Rosacea is a skin condition that makes your face turn red and can cause swelling too. It makes people look like they're blushing. They can blush very easily. And it also creates these little spider-like blood vessels. And I had a bunch of them on my cheek.
Yeah, so that's
cheeks.
the answer to our riddle. What does Molly have? Rosacea. And this is Rosacea Awareness Month. So Dr. Deborah Manjoney is here from the Wisconsin Vein Center MediSpa with more on rosacea.
Yes, hi.
Good to see you.
Thank you. Nice to be back.
We were
Thanks for
saying we
talking
love
about
the way
this.
your shirt matches our flowers.
Yeah.
Oh, yes.
It's beautiful.
It's that time
we know
of year.
people are going to say it. It's beautiful.
I know, and it's actually from Faze, which is so cool. I love your sweater. Thanks for talking about this. I appreciate it because I think it's so many people have it.
Yes, they do.
And I did not know that I had rosacea. I always just thought, why do I have such red cheeks? Oh, I'm Irish. And I was actually at a makeup counter, and the woman's like, well, since you have rosacea, I'm like, I do not, because I didn't really know what it was.
And there's so many different stages or categories of rosacea. It's really, you know, quite a range.
Right.
It can be a little bit of pink flushing of the cheeks or little vessels in the cheeks. And then there's an acne form where people get little kind of rounded off bumps on their nose. And it's usually the central part of the face, what they call the convexity of the face, you know, the area that sticks out. So it's the forehead, the nose, the cheeks, kind of a T-zone that can be involved.
Well, and I got so that I was very self-conscious to not wear makeup. And I like, especially on weekends, to take a break from makeup and just, you know, wear nothing. And I was very self-conscious because you could really see the veins in my cheeks. And the veins are common with rosacea, aren't they?
Very common. They're very common.
And is it curable?
Well, there's not really a cure. There's not really a known reason why people get rosacea, and there's not a cure. But there are definitely ways to control it and to prevent it from being as much of a problem as it can be. As I said, there are lots of different stages, and then people can figure out what triggers the real redness and the appearance of their face, making them look like they're flushing and blushing, or trigger off even some of that inflammatory reaction with the breakouts.
So what are some common triggers for people who tend to notice that they get a little pink in the cheeks? I usually I had gotten it just on one cheek for a while. So what are some common triggers for people?
The most common trigger is sun and then heat. So the sun and the heat are very common. Spicy foods, wine, alcoholic beverages can be. Even a change in temperature, cold can do it too for some people. Real strenuous exercise. There really are a number of different things. And there are also, people have to realize when they have rosacea, it means they have a sensitivity on their skin. So their skin is very sensitive, and so products can even make you have more of a reaction and look redder than you need to be.
Are there certain things you should look for in products and then avoid them?
One of the things you should avoid is sodium lauryl sulfate.
And that's in a lot of
products.
products.
That's in a lot of things. So, you know, avoiding the sulfate type of things, like what we do for our hair too, you know, we're trying to avoid those sulfates. Avoid it in cleansers for the skin. You know, a lot of people used to think that glycolic acid was good to help do a peel on the skin, and it is wonderful for a lot of people, a nice refreshing peel. But people with rosacea, it may help temporarily, but it can actually continue to cause more inflammatory response. So you have to be careful with something like that.
Let's talk, because you brought some before and after pictures. Let's talk about treatment for it, because I recently visited the Wisconsin Vein Center MediSpa. I can't tell you how thrilled I am with the treatments. I had just 3 treatments, but even after the first one, I noticed a dramatic difference.
Right. Intense pulse light treatments, or as we call it AFT, which is advanced fluorescent technology, uses multispectrum light and uses proper filters so that we are basically treating the skin, and the light is being absorbed by the redness, by the brown spots. And so it really, really does help to, number one, destroy those little blood vessels that you might see under the skin and just reduce the discoloration, the redness and pinkness, and help even out the skin tone. So it's really great.
For me, none of those veins are visible anymore without any makeup. I mean, and it's I don't have any of that redness in my cheeks anymore. And even after washing my face or taking a warmer shower or a hot bath or something like that,
it really makes a huge difference.
I mean, it's incredible, and I feel so much better now without makeup.
Right. Now, there are advanced cases of rosacea that may take more than 3 treatments.
Okay.
You know, there are people who actually have changes in their skin from the chronic inflammation, where, you know, if you think of people, actors who've had large noses, Carl Malden, Jimmy Durante, that's rhinophyma. And that's actually a secondary result of rosacea.
Oh, wow.
So it's very advanced rosacea that wasn't treated, or there was no treatment for back then. But it can be treated. And so people really do need to know what kind of things can be done to try to reverse some of the effects of rosacea, prevent it from getting worse, and really know about proper skin care, which is really essential. That's one of the things.
Can there ever be anything topical, or is there ever any prescription medications that are used for rosacea?
Yes, there are actually several things. You know, for a long time, the tetracycline antibiotics were used orally for rosacea. Now there's something called Rosacea, which is actually a tetracycline, but it doesn't have an antibiotic effect. It's an anti-inflammatory effect. And so it works specifically for people with rosacea because they don't have a bacterial infection. It's an inflammatory response. And this works very, very well orally to help control it. There are also topical prescription medications that can be used. Metrogel is one of them. Then there are many, many products that can be used just for sensitive skin. And so that's going to reduce that redness and that response. And there are things that have some salicylic acid in it, which is an excellent treatment for rosacea, as well as many, many other skin conditions. Using antioxidants is a very important thing, especially when you're out in the sun. You want to reduce that red response. So an antioxidant mixed with something that may block that nerve response, which is what people are now thinking is causing rosacea. It's a response of the nerves to a stimulus like heat or like the sun or alcohol. And the nerves, you know, they have a neurotransmitter that then is produced, and as that is going to the target areas, it's releasing some other kinds of irritants, histamines and cytokines and these other things that really are causing the inflammatory response in rosacea.
Well, and we showed some great products.
There are really a lot of products that are non-sensitizing and anti-inflammatory.
And people should ask about those specifically because I see a cleanser there too that I think I used, as well as some of the topical creams. You can find out more about rosacea, treatment for it, as well as a great way to take care of your skin if you have this condition. Just call the Wisconsin Vein Center and MediSpa and set up a consultation. They're located on Georgetown Drive in Pewaukee. The phone number is 262-746-9088 or go to wimedispa.com. So great to see you. Thanks for talking about this.
Thank you very much. Appreciate it.